Rachael. I'm going to be your nurse today. I just finished washing my hands.
Awesome.
Hand washing is the best way to prevent the spread of infections. That's for your protection. How are you doing today?
I'm well. Yourself?
I'm doing well.
Good.
Today we're going to do a quick head-to-toe assessment. It will take about 20 minutes, so bear with me. If at any point during the assessment you have any questions, feel free to stop me and ask those questions. And everything we talk about today will be kept private under HIPAA.
Sounds good.
You have any questions before we get started?
No, go right ahead.
Okay, so first I'm going to assess his level of consciousness. I will assess who, what, when, where, and why. So, who are you? What's your full name?
My name is Luke George Lippig.
Okay, and what are we doing here today?
We are doing a head-to-toe assessment.
Correct, and what date is it?
Today is the 8th of March, 2020.
Correct, and where are we today?
We are at my home in Coleman, Arkansas.
Very good. And how are you feeling today?
I feel good.
Okay, so he is alert and oriented ×4. His mood and affect are appropriate. His speech is clear. He's able to carry on a full conversation with me. And his facial expressions are appropriate, consistent with his mood. So I'm going to next test your recent and remote memory. I'm going to give you 4 completely unrelated words, and I'll ask them at different points during this assessment and make sure your recent or remote memory are intact. So your words are fire truck, dog, airplane, and hat.
Fire truck, dog, airplane, and hat.
Yes.
Okay.
Okay. Next, I took his vital signs before we got started. His blood pressure was 130/75. His heart rate was 72. His temperature was 97.8, and his respirations were 16. These are all within normal limits for him. And are you in any pain today?
Mm-mm.
Okay. So next, I will move on to the skin assessment. I'm going to look at your arms and your chest and neck area.
Okay.
So his skin is pink, it is warm, it is dry and intact. I see no lesions or scars, no tattoos, no rashes or scabbing. It's warm bilaterally. Are you having any tenderness as they touch you anywhere?
Mm-mm.
Any pain, so to speak, of on your skin anywhere right now? And then his skin turgor is elastic. Next, I'll move on to your head. His head is normocephalic. It is symmetrical. His hair is dark brown and wavy. It is thick and evenly distributed. It is clean. His scalp is pale. I see no lesions, no scabs or sores, and no parasites present. When you look at me, his face is symmetrical. His eyes are in the upper third of his face. His nose is midline. His eyebrows are coarse and evenly distributed. Then at this point in time, I would assess cranial nerve number 7. That's the facial nerve. Will you smile for me? So his face is not drooping. And then if you close your eyes, I'm going to try and open your eyes. So resist me opening your eyes. Okay, so cranial nerve 7 is intact. He's able to resist me opening his eyes. Next, I will assess the trigeminal nerve. So if you could clench your jaw really tight. Okay, so his masseter and temporal muscles are strong and equal bilaterally, Now, if you close your eyes, I'm going to touch your face and tell me where on your face I'm touching you.
Okay. My left cheek,
Mm-hmm.
my chin,
Mm-hmm.
forehead,
Yep.
and right cheek.
Very good. So his trigeminal nerve, cranial nerve number 5 is intact. Next, I will assess your nail bed. I'm going to do this on your fingers and your toes. So his nails are nicely trimmed. His cap refill is less than 3 seconds. I see no clubbing, no cyanosis. The nail beds are translucent. And then I will assess your toes here. And also his nails are trimmed and his capillary refill is less than 3. Okay, now moving on to your eyes, and my light is over here. Looking at his eyes, I see no drainage or redness. His eyelashes are evenly distributed. I already looked at his eyebrows. They're coarse and evenly distributed, with no lesions or sores or scabs. His pupils are equally round. They're about a 4 millimeter. I'm going to turn off the light. I'm going to assess your pupils' reaction to light. Very good. And his pupils are reactive. Now, will you look at me and then look over my shoulder and then look back at me? So his pupils are accommodating. Next, I would assess optic nerve number 2. By use of a Snellen eye chart, he would stand approximately 20 feet away and read off the lines of the eye chart to me. He does not wear glasses, but if my patient did wear glasses, I would ask them to read this chart with his glasses on and with his glasses off. You cover up one eye, read the chart, and then cover up the other eye and read the chart again. Then I would test cranial nerves 3, 4, and 6. That's the oculomotor nerve, the trochlear nerve, and the abducens nerve. So we'll do that now. So just follow my thin light, okay?
Okay.
Okay, one more time. So his abducens nerve, trochlear nerve, and oculomotor nerve are intact. There's no nystagmus noted. And did you have any double vision while we did any of that?
Mm-hmm.
Okay.
Yep.
So next, I could use an ophthalmoscope to have a better assessment of his eyes. I would, it shines a light directly into the pupil. It helps you to assess the retina and the inner parts of the eye, and you can also diagnose certain diseases such as glaucoma with an ophthalmoscope. Next, I'll look at your ears. When you look at me, his ears are symmetrical. They are level with the palpebral fissure. The tip of his ear is level with the palpebral fissure. They are elastic with immediate recoil. I see no drainage. I see no lesions. Looking inside his ears. I see no foreign body, and a small amount of cerumen is noted, which is completely normal. And were your ears tender while I was touching you?
Mm-hmm.
Okay. And he doesn't have any piercings. So next we will test cranial nerve number 8. That's the vestibulo-ocular nerve. So I'm going to ask you to plug this ear, and I'm going to stand a couple of feet away, and I'm going to say a 2-syllable word.
Okay.
And you just tell me if you can hear me whisper that word.
Okay. Water.
Very good. And then I'll do this one.
Jacket.
Very good. Try not to knock over the lamp. So cranial nerve number 8 is intact. I could use an otoscope at this time to look, to study the inside of his ear a little bit deeper. An otoscope allows you to assess the ear canal, the tympanic membrane in the eardrum. So next we will assess your nose. So his nose is midline in the middle part of his face. Will you plug up one nostril and sniff? And then plug up the other nostril and sniff. So his nares are patent. Then I will palpate your maxillary and temporal or your maxillary and frontal sinuses, excuse me, for any tenderness. Do you feel tenderness?
Mm-hmm.
Okay. Now I will test the cranial nerve number 1, that's the olfactory nerve. So we're going to test your sense of smell. So close your eyes for me. And I'm going to, when I say sniff, tell me what you're smelling.
Okay.
Okay, sniff.
Coffee.
Very good. I'm going to reach across you real quick. And sniff.
Garlic.
Very good. So his olfactory nerve, cranial nerve number 1, is intact. Next, I will assess your mouth. His lips are symmetrical, they are moist, and they are not cracked. He doesn't have any sores or anything like that. So you open your mouth for me. So he has all of his teeth. They are in good repair. He has good dental hygiene. His oral mucosa is moist and pink. His buccal mucosa is uniformly pink without lesions or swelling. Will you open or stick out your tongue for me? So the top of his tongue is pink with rough papillae. Will you lift your tongue up to the top of your mouth? The underside of his pink is moist and there are veins present. So stick out your tongue and say ah. So that was testing cranial nerves 9 and 10, the glossopharyngeal and vagus nerve. When he opened his mouth and said ah, his uvula went up with phonation, and his gag reflex is present because he doesn't really like me sticking this tongue depressor in his mouth.
Nope.
But that's a good thing. Cranial nerve number 12 is the hypoglossal nerve. Will you just stick your tongue straight out at me? So his cranial nerve number 12 is intact. I didn't realize I was still on. His tongue did not deviate to the left or right when he stuck his tongue out at me. Oh, and let me look at your tonsils. Say your tongue out one more time. So he has tonsils. They are not swollen. They're about a 1+. And his hard and soft palate are smooth and continuous. His hard palate is white with transverse rugae. And I think that is all of the mouth assessment. So we'll move on to the neck.
Okay.
So the skin on his neck is pink. It is consistent with the skin on his face and arms. I don't see any lesions or scarring or tattoos. Will you turn your neck to the left and the right? And then up and down. So he has full range of motion. I didn't feel any crepitus while he was moving his neck around. And then one at a time, I'll palpate your carotid arteries. If we did that at the same time, it would lose blood flow to your head and make you dizzy. Possibly make you pass out. That would be a bad thing. Okay. I can feel his pulse. Next, I'm going to listen to your carotid arteries. So I'm going to tell you to hold your breath. Hold your breath for just a second so I can listen and see what they sound like. Ready? And go. Okay. And ready. Okay. So I didn't hear any bruise, which could indicate that the arteries have plaque buildup and are becoming occluded, which is not a good thing. So no bruise were noted, so that was normal. Then we'll test cranial nerve number 11, which is the accessory nerve. So hunch your shoulders up like this for me, and I'm going to try and push down on them. Okay, very good. So his sternocleidomastoid and trapezius muscles are strong and equal bilaterally, and cranial nerve number 11 is intact. So next I will assess your lymph node system. So I'm going to feel the pre-auricular, the posterior auricular, the tonsillar, occipital, segmental, submandibular, the posterior cervical, and then will you turn your head that way for me? Deep cervical, and then turn your head towards me. Deep cervical again, and then look straight ahead, and your supraclavicular. Okay, and I didn't feel any swelling. Was anything tender that I touched there? Okay, so his lymph nodes, they're not swollen and they're not tender. Next I'll assess your thorax and lungs area. We'll look at the skin on your chest one more time. So it is uniform in color and with no lesions or scarring. So you scoot way forward for me so that the camera can see me listening to you. Okay, so looking at his spine is midline. His back, the spinal curvature makes an S shape when looking at it from the side. We already assessed his skin curvature earlier under his clavicle, but it is elastic with no tinting. So now I will also take your lungs. Just take deep breaths for me.
Okay.
Take a deep breath and release. 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 Okay? Now you turn to the side and we'll try to get to where the camera can see. Listening to your back here. Alright, same thing. Take a deep breath and release. Deep breath and release. Deep breath and release. Deep breath breath. Deep breath. Deep breath. Deep breath. Deep breath. Deep breath. And last one, deep breath. So his lungs are clear and equal bilaterally with no advantageous breath sounds. One more thing I have to do on your back. Sorry. So I need you to take a really deep breath. Well, sit up straight first and then take a deep breath.
Okay.
So take a deep breath. Okay. And my thumbs separated further apart with expansion. And then I need you to say 99.
99.
Say it again.
99.
And again.
99.
Okay. So I felt equal amounts of vibration when he said 99 throughout his back. And then that is it for the chest assessment. Can you tell me what those 4 words were?
Yes, fire truck, dog, airplane, and hat.
Okay. So lastly, we would do a breast assessment. We're not going to do that on this video, but it is important to note that it is, although it's not as likely for men to get breast cancer, it is still possible, so it's important for men to do a breast assessment as well. We would have our patients sit in 3 positions with the arms over the head, arms on their hips, and lean forward. We would assess for symmetry of the breast, dimpling, lumps, and uniformity in color. We would palpate the axillary lymph nodes all the way down. There are 3 different ways you can assess a breast. You can do the spokes of the wheel method, where you go in towards the center of the breast like spokes on a wheel all the way around, or you can assess by moving your fingers in a circular motion all the way around the breast. Most commonly is the vertical stripe method, where you start from one side of the breast, go all the way down, all the way up and across, and you're feeling for those tenderness areas and new lumps and dimpling. So the nipples should be everted. The nipples and the areola should be darker than the rest of the skin on the breast. And when you squeeze the nipples, you're going to assess for any abnormal discharge. So one last time, what are those 4 unrelated words?
They are fire truck, dog, airplane, and hat.
Very good. So his recent and remote memory are intact. Everything was within normal limits today, and that completes our head-to-toe assessment.